So for GI Nutrition Labs, I have the My Plate by the U.S. Department of Agriculture here, and it shows a example of what people should have on their plate for healthy nutritional status. And beginning our assessment, we want to look at signs and symptoms of nutrient deficiencies. The labs that we're going to look at are the serum proteins, because those are indicative of how food is metabolized in the body and if it's metabolizing correctly. We're going to look at cholesterol levels. If the cholesterol levels are high, that means that our patients aren't following a healthy diet. We're going to look at BMI and body weight, skin fold measurements, and we can look at food diaries and journals. We also want to get a comprehensive history because we want to find out the root of why they're not in good nutritional status. They're either malnourished or obese. We want to know why. It could be drugs, it could be comorbidity, a hormone deficiency, it could be a number of things. So we want to get a full comprehensive history. A couple of diagnoses that we could use are obesity, overweight, imbalanced nutrition. Patients could have disturbed body image, activity intolerance due to their weight, risk for malnutrition, that's important, and readiness for enhanced self-care in regards to their nutritional status. For planning, we want to consult a nutritionist or a dietitian. We want to do this because those are the experts that are going to know what foods that our patients should be eating, and they can bring us educational tools for teaching. And then implementation, we could use meal plans. We could educate and teach our patients. If they are severely malnourished, we could do TPN or a feeding tube. We want to learn how to properly care for those and feed. There's surgical management, so we might have to take care of patients post-op that are not in good nutritional status. And that could be gastric bypass surgeries, sleeves, anything like that. Drug therapy, there are drugs that can help patients lose weight and then help with the anorexia. And then nutritional supplements if our patient has a nutritional deficiency, a nutrient deficiency. And then for the evaluation, we can look at food journals. We can look at the weight loss diary, which I have an example of here, and we can listen to subjective reports. Our patients are going to know best how they're feeling and what they're eating.